My name is Irina Mozhaeva. I come from University of Latvia. I'm a researcher there, and I also am an external consultant for the OECD. I implemented a number of national research projects as a team member with the World Bank teams and OECD teams in Latvia and Estonia.
And how would you explain what you do to a layperson?
Well, I do a lot of work with administrative data, survey data, using statistical and econometric methodologies, and I take part in preparing national reports for the government and elaborating policy proposals.
What would you say are currently the three main policy priority areas for long-term care in your country?
Well, given that I've been involved into the World Bank project in Estonia related to long-term care, within this ILPN conference, I'm presenting some materials that are related to case of Estonia, so let me speak about a system in Estonia within this interview. So one of the main priorities is reducing burden of informal care in Estonia, especially within the working age cohorts. The second priority is providing social and financial support to informal caregivers because they are the backbone of the current long-term care system in Estonia, and the reliance on familial care is really unusually strong within Europe and Estonia. And the third one is trying to incentivize cooperation between health sector and social long-term care sector, because we can see that within the recent years in Estonia, public expenditure on health LTC is growing really fast, while it's not so fast for social long-term care. And the two systems have to be balanced to reduce the pressure on hospitals and the pressure on budget, because inpatient care is really expensive.
And to what extent do you think these priorities have changed in the last 5 years, if at all?
Yes, they have. The underlying problems, the problems of increasing burden of informal care and increasing budget of health, long-term care, they are deepening, and that's why these priorities become more and more urgent, actually.
If you have an opportunity to introduce one new long-term care policy in Estonia, what would it be and why?
One of the main grey areas in Estonian system is care for demented elderly, and it's not only the problem of Estonian system but overall in Europe, of course, due to the fact that frail demented elderly need more secure environment. They cannot be always kept in general care homes, because general care homes, according to human rights, have to keep doors open. And due to necessity to care for their elderly parents, a working age population has to quit labor market quite often. And another problem that is still persists in Estonia, that there are no care allowances for demented elderly, unless at least they have the official disability status. Then they have the disability allowance.
In terms of research priorities, what do you think is an outstanding piece of research on long-term care that needs to be carried out in Estonia?
It would be really great, based on the administrative data, to analyze the effect of use of home care services, formal home care, on utilization of inpatient care, to see how efficient is use of home-based care in reduction of demand for inpatient care, because we know that unit costs of home-based care are much lower than unit costs of inpatient care. Currently, everybody knows about this problem, but funding of home-based care is not being increased as much as the demand for such services increases. So showing the real numbers of cost reduction thanks to increase in home-based care to policymakers would make them making the correct decisions faster, I suppose.
So now I'm going to ask you a few quick questions, and I'm looking for a number in response from 1 to 10, where 1 is low and 10 is high. So what policy priority is allocated to long-term care in Estonia?
Well, I would say 6 to 7, more to 7. While the long-term care service coverage is currently very low and budget is quite low, the related issues are quite high on the policy agenda. So we're expecting to see quite substantial changes in the nearest future.
How aware is the general public in Estonia of what the long-term care system offers to them?
Well, to answer this question more precisely and to be more honest in the evaluation, we have probably to split the system into two components, health and social. Because when we speak about healthcare services that are funded through Estonian Health Insurance Fund, then we can say that population is quite well informed of what can be offered to them. Whereas social long-term care is financed through social budgets of local governments. And when we conducted interviews with the local governments within the mentioned World Bank project, we realized that local governments actually do not advertise their services because their social budgets are so restricted that they understand that if everybody knew about what is being offered, they would not be able to meet the demand. So I would say that quite a substantial share of the eligible persons in Estonia is not informed about social services provided by local governments, and we can say 5 to 6 points here.
How well does the system support people with long-term care needs?
Well, I would say we can put 6 here because the coverage is really low in Estonia, although disabled population is covered with disability benefits, but still reliance on family care is too huge.
And how well does the system support the needs of carers?
I don't think there was any broad estimate of the needs of carers in Estonia, but all the local governments provide caregiver allowances in Estonia, so we can say that we can put 7 here. Given that caregivers receive this financial support, however, generosity of this support depends on the municipality. It also depends on age of the disabled person under care, and also depends on severity of disability. There are 3 disability groups defined in Estonia, and the generosity of municipalities differs a lot. So caregiver allowances vary across municipalities from 7 euros per month to 200 euros per month. One still undersolved problem is support to families with disabled children, because state budget, which finances, for example, such service as relief for families with disabled children, is way lower than it would be necessary to provide really feasible support to such parents. Mostly one of the parents has to quit labor market in order to provide decent care to his or her disabled child, and much greater funding would be necessary in this respect.
And how integrated are social care and healthcare services in Estonia?
Well, the problem is similar to many other European countries where health is funded through state budget, like in case of Estonia through Health Insurance Fund, whereas social system is funded through budgets of local governments. And these separated financial flows, of course, do not incentivize integration of care. In Estonia, there is an incentive of developing primary care centers, which should try to balance the two systems and to manage the patient flow through healthcare and social care. So I hope that in the nearest future I will be able to put 7 or 8.
Thank you very much for your time.